Well, hello everyone. Glad you could join us tonight. We've got an exciting program tonight. I've got Dr. Ryan Cole, who's a pathologist from the US, and I'm sure you're going to find him very, very interesting, as well as Dr. Hayman Buwan, who's from the Toronto, Canada, Ontario, Canada area. And right now he's been traveling, so he's coming to us from Florida. And I've also got a good friend of mine, Winston Neal, who was able to experience the helmet for his situation with the stroke that he had. So we got a great program coming up tonight. So at this point, what we're going to do is just our opening video, and then we'll get right into things.
15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cell super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your fingers, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about a foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs.
All right, now we're going to invite our guests on. Dr. Ryan Cole is going to be come on, and Dr. Ryan Cole is in Idaho. He'll correct me in a minute. Where are you? What state?
You're correct. Yeah, we touch Canada. I'm in Boise, Idaho. So we're out west here in the Rockies.
Okay, all right. And so just in a minute, we're going to now introduce Dr. Hayman Buwan. Do you want to come on, Hayman?
Yeah,
there we go.
Sorry, just moving around here. Hi, it's Hayman. So I'm currently in West Palm Beach.
There we go. All right, excellent. What's the weather like over there?
It's nice. Actually, there's some great anecdotes regarding the palm light, near infrared light, and the sunlight. I'll tell you, it's funny. I've had experience with 2 coasts, and even if you have that much sun, the red light still helps. That's one observation I've had so far.
Excellent, excellent. And so, Hayman, you have your background is physiatry. That's your study. Now, most people wouldn't understand what physiatry is, so maybe you could mention.
Yeah, so physiatry is one of the oldest specialties in medicine. It's an MD degree. And also there's a PhD, doctor osteopaths in the US who also do it. So it's a officially recognized residency that initially catered for the World War I veterans, amputees and so forth. But now we cover everything that requires rehabilitation. So everything from brain injury, stroke rehab, cardiovascular rehab, amputees, burn patients, anything you could think of, even concussions, sports medicine, and so forth. So covers a lot of areas.
Excellent, excellent. And Ryan, do you want to tell us a little bit about your pathology, what you've been doing?
Sure, I'm a anatomic and clinical pathologist. I trained at the Mayo Clinic in Minnesota, and I ran an independent lab here in Idaho for many decades, and now more on the research side of things. And pathologists, we study cells and we study patterns and we study inflammation and we study cancers, and we understand or strive to understand the mechanisms of disease. And so we're the doctor to the doctor. And so I'm that magical, most important doctor that you never meet that you always hope is correct. So on the tissue side of things, we're always looking at what effects different things have on the tissues.
So, both of you have had a chance to learn about PBM. Maybe Ryan, you want to start off with when did you first find out about PBM, and when did you meet me, and how did that happen?
Sure. I mean, I've always been a fan of good sunlight and good vitamin D, so I've always loved the light. But I have a little organic farm here in Idaho, a little 20-acre farm, and I was out throwing a bale of hay just over 2 years ago, and as I threw the bale, I tore my bicep tendon. And I went to my physical therapist, and he said, well, it's going to be 2 to 3 times a week for about 4 months. Well, I happened to be giving a lecture up in Toronto and was at dinner at a friend's house, and Tom happened to be there. And she mentioned my shoulder to Tom, and Tom said, oh, well, show me your range of motion. It was very limited. And he said, I've got one of my devices out in the car. Let me run and get it. And so he ran out to the car, and while I was standing there having dinner conversation, kept the light on for about 15, 20 minutes. And then he said, now, how do you feel now? And the pain was gone. And I had about 30, 40% more motion just after that 20 minutes. And I kind of shook my head, and I'm always a skeptic and a doubting Thomas. And he said, take it with you and see how you do. So instead of 4 months of physical therapy, in 4 weeks, I was better and back lifting bales again and doing all my farm work. And that's when I started kind of the deep dive into the research as to what are the mechanisms as to why near-infrared light and photobiomodulation have such a beneficial effect on the cells of the body.
Yeah, I remember when you did the presentation too. You did the presentation up front, and you were talking about inflammation in the body, but in particular in the heart muscle, with myocarditis. And I went up to see you because as soon as I heard inflammation, we're the new inflammation busters. Who you
That's
gonna,
the goal. Yes, that's the
yeah, who
goal.
you gonna call?
Inflammation busters.
So I I went up to see you, and I said, hey, your slide, what about having inflammation, using PBM red light therapy to reduce the inflammation. And I can remember, I do remember your response. He says, well, I was even thinking of putting a slide in about the possibility. So can you just mention about myocarditis and what we're thinking about there?
Yeah, absolutely. And I think this is a critical area of research that it's already been done in mouse models. It's been done in vitro models. And with heart inflammation, when you hear the word myocarditis, that means inflammatory cells invading the tissues of the heart. And then you can hear the word pericarditis, which is the sac that protects and surrounds the heart. So the goal is to figure out how does one turn off that inflammation. And certainly doctors will use steroids or colchicine or other medicines to try to do that. But I had been aware of a paper that showed that the T cell that is responsible for inducing much of the inflammatory process, it has little pattern receptors, and there's a receptor called toll-like receptors that all of our cells have, and our inflammatory cells, it's like a toll road, and so those can be clicked on or off. But what's interesting is near infrared light at a certain wavelength can shut that toll-like receptor number 4 off, which slows the inflammatory pathway. And so that's critical in that inflammation in the heart. So it has fantastic potential. And again, we need to do more human trials on this.
Right.
But in the models and in the lab studies, the way it turns off inflammation is amazing. And it also reduces the propensity of the heart cells to self-destruct. So there's an enzyme called caspase-3, and it reduces the self-destructive process and that enzyme in the heart, so those heart cells don't get damaged and lost and scarred over. And when that caspase-3 goes down, then the membrane of the cell, the cardiac cell, stabilizes. And and so when you get that lack of oxygen to the heart and then the reperfusion or the reoxygenation of the heart, that cell is protected. And then the other thing the light will do, it will enhance the activity of the mitochondria in the cells, and that's the powerhouse of every cell. So you hear the word ATP, adenosine triphosphate. That's the end product of the mitochondria making energy for every cell in your body. So it will enhance the energy in the cells, and it will also increase a very important molecule that we all make in our blood vessels called nitric oxide. And so in animal models, it has lowered or mitigated the risk of cardiac damage, again, in animal models by up to 76%. So that means of 100% of tissue that would be lost, 76% is protected just by this light pathway. I'm of the opinion that in 5 to 10 years, every shock device that's on an airplane or in a public setting, those AED devices, are going to have a light panel associated with them because of that protective effect on the heart cells. Again, like I said, we still need to do more human studies, but the potential is fantastic.
Thank you very much for explaining that. And Hayman, how did we end up meeting? And how did you learn about PBM, or vice versa?
Yeah, so for me, as you know, it was devastating reasons that I met you. So my father, back in May of last year, sustained a preventable serious medical incident. So basically means that there was a mishap post-surgery. Great surgery, but unfortunately, there was no monitoring. So he had an choking incident right after he finished the surgery, and he sustained an anoxic brain injury. And I was at his bedside in the ICU and looking up current research. I had spoken to my colleagues in brain ABI, which is acute brain injury or traumatic brain injury rehab. And they said, based on the time, give him some time and healing. But I also wanted to know what other current evidences that's out there.
Right.
And it just happened that a Massachusetts General article came out about traumatic brain injury. It's not anoxic, but still close enough, where they had PET studies. So they had this is functional radiological studies that showed improvement after patients were given photobiomodulation, so red light therapy. So I started off, in the middle of the night, I ran over to an engineering friend's house. He had a panel of the right frequency, nanometer of light, and started the treatment within 51 hours. So you're supposed to start it within 72 hours, according to their protocol. Started within 51 hours. And a week later, we started noticing changes that were unique, that we weren't expecting, like in terms of his feet movement, like the toes. And interestingly, he has a burr hole on one side of his head. So light was able to penetrate. Burr hole means it's just a hole in the head that's covered by skin from a previous surgery. And that light went through deeper. And what happens is our brains control the opposite side, right? For instance, right brain would control the left side of your body. So for him, he was starting to develop movements on the left side. So these small toe movements and he's right-handed, by the way. So he's much more dominant on the right side. So left side was recovering. So I immediately contacted Margaret Naser, the pioneers in this space. And she was saying, you know what, light might not be strong enough. And have you heard of Tom Kerber and SunPowerLED? So I said, no, but where is he? And she said, he's in Hamilton, Ontario, which is basically an hour and 15-minute drive from me. And I did my residency in that town, right? And I didn't even know you existed. I didn't even know photobiomodulation existed during my training. So we contacted, I think next day, right? I was at your office.
Yeah.
and got a photobiomodulation transcranial helmet, the helmet that you have, a slightly
Yeah.
modified version, so you could be used in the ICU environment.
Almost like this one here. There you go.
Exactly, same power, everything.
Yeah.
Um, and so I started using that, and so far he's been making some cognitive improvements, which are unexpected for him. Which again, we know he's going to have some impairments, but that was enough for me to sort of delve deeper into this. Dive, like I've been diving ever since, trying to figure out what is this red light therapy that I've never heard about. I've only heard of infrared therapy, right, for heat
Yeah.
lamps and everything else for joints and everything else, but I've
Yeah.
never heard of photobiomodulation. And so one thing led to another, and I started diving in. Of course, Tom knows that I'm pretty guarded because of my medical training and everything else. I need to have that evidence. I need to see firsthand how it works
Yeah, he
before
was a toughie.
I know I have to before I can recommend it, right? Because the last thing you want to do is like sell snake oil, right? And last thing also, people are desperate for things, so you don't want to say the wrong thing. You don't want to promise the wrong thing. So I needed to know more, and that's why I'm on this sort of a mini trip as well. I'll explain later what I've been doing so far.
Right. Well, that's excellent. Winston, if you want to come on, turn on your microphone and your camera. We'll see you in a minute here. As soon as we'll get into that. But so it's been great to be able to get to know both Hayman and Ryan, and now there's doctors. I've met many more doctors who have now learned about PBM, and they're advancing their knowledge on this whole area. We do is we're just providing enough power, like so it can go into the brain. It's kind of like if you were on the Atlantic and somebody fell overboard on the ship, you can use light to find the person. You can use a candle, and that might not help you very much. You might just see over the edge. But if you pulled out 1 million candle power light or 10 million candle power light, you could look 5 miles out and see somebody. So you need to have enough optical power for that light to go into the brain, into the shoulder, as Ryan was using, whether it's into the brain, shoulder, or other parts of the body. You do need enough light to do it. And so we have Winston on right now, and Winston, welcome to our program. Winston is a good friend of mine, and I thought the two doctors could interrogate you. No, not quite. But I'll just mention what happened is Winston had a stroke, and how old? That was about 2 years back, Winston.
Yeah, that would be two. Yeah, it was. I would say that would be two Good Fridays ago.
2 Good Fridays ago. Okay.
Yeah.
And I got a chance to hear that he was, well, here. When I talked to him, I could barely understand him. And when I met him face to face, but on the phone, it was impossible. So I said, look, Winston, come on down. Come on. Come on. You got to try this light out. And it's my helmet. So he went under the light. And Winston, what took place? That was one treatment. What happened?
Well, the thing is, at first I was reluctant. I didn't take it seriously, your invitations, but then I decided, well, I might as well do this. And when you told me that you couldn't really understand me now, I didn't know that you couldn't understand me or someone on the phone on the other end couldn't understand my speech. I thought everything was okay. But you said to me, no way. So I
Yeah.
got on the light. I think we had a 3 to 5 minute session under the
Yep.
light. And you said, wow, I could understand you quite better. And then, of course, I was getting the same reaction from other individuals speaking to them on the phone. Maybe perhaps I should have done a series of sessions. Maybe I might have been able to speak Yiddish or Hindu or something else. But
I don't think
no,
that'll work.
but really, it worked extremely well, and um, I haven't had any problem since. And of course, as you know, singing and vocalization was my thing, singing in choirs and so on. So this was great for me because my performance was enhanced, my speech, presentation, everything else. I never looked back since.
Yeah, Winston can really, really sing well. He's quite the person to hear in the church. Sometimes you do. Everybody can hear you that you're in the church, Winston.
But well, the thing is, what the reason I do that is to strengthen my vocal cords and to see how far I could project my voice to the other wall of the church.
I know. I'm not holding it against you.
And it has helped because it helped to strengthen my vocal cords.
Yeah.
So at least that's the reason why I take the tenor parts and so on and try and see
Yeah.
how much my voice can project itself.
Just curious, Ryan or Hayman, is there any question that you're curious about, or?
Yeah, so I'm curious, how quickly did you notice a difference, Winston, when you had the therapy? Was it one session, two sessions, couple of sessions? How quickly did you see results?
It was one session.
Wow,
It was one session.
that's amazing.
Yeah.
And also, Winston, one thing you said you had speech difficulties. Was it like speech production? Like, would you have problems with your vocal cords only, or did you have word finding difficulties or difficulties like thinking of the words?
No, it was actually it was when to me, I was speaking well. To me, I had full control. But what was coming out, what others were hearing, was not what I perceived them to be hearing. And that was the problem. I felt I should have been understood because I thought I was being understood.
Isn't that cool?
Yeah.
Well,
and there's actually good research. Margaret Naser actually has a lot of research, and I'll tell you later about that. And there's a little more research in terms of how to treat patients with communication disorders after a stroke. And it has to be unilateral treatment, so not the full head transcranial. So we could talk more, Winston. It's about treating the areas that are affected more than treating the whole brain. It's a matter of treating the area. It's constraint therapy, basically.
Right.
Yeah, and it's possible to do that. But in this case, I didn't know enough about things, so I just helped him out and he got better.
Yeah, it's good.
Okay, Winston, thank you for joining us tonight. And we're going to go now with another part of the program. So thank you, Winston.
Nice to meet you guys.
Great to see you, Winston. I'm glad you're doing so well.
Thank you very much.
Keep the healing going.
So Winston is I think is it 84? I think he's 84. He's doing very well. But now what I'd like to do is we're going to throw over to the video now, and we're going to play the two autism videos.
So this is your third treatment, Logan?
Yeah.
Max, you're helping?
Yeah, we're going to start 3 days a week.
3 days a week. What have you noticed with Logan so far?
So far, we just with the amount of self-induced behavior that's done, he's really calm right now.
One thing that's been going on a lot lately is he is like attached to me, and it gives me anxiety. Like, I'm talking, he follows me everywhere I go. He's leaving me space now. He's down in his room watching his videos, and he comes up and gets a snack and he goes back down.
Yeah, so we've noticed that with some other people with autism as well, like clearness, responsiveness.
Yeah.
Can I get a fist bump?
There you go.
Awesome, man.
I don't know how to explain it. I can't get the words out, but we've noticed a difference. We've noticed a difference. Absolutely, yeah. All right, you want to say bye?
she's very excited to come.
Yes.
And that in and of itself tells me something. And she was telling Josh how she's very excited. She thinks this is going to really help her.
Wow.
So we know that there's a lot going on with the mind and the brain. And when I started researching this, after my in-laws got the handheld, I said, wow, there's more than just one research article about using this for individuals with autism, and there's one study about adults with autism. So I'm hoping that this therapy will also help us as we move towards it. And that's what I went to the Speller Center for. You know, I've been praying for, because I found feeling kind of stuck for months, you know, like, what do we do for her? There's something else. There's something else. There's something else that can help us get her over the hump of things. And I don't know, God led us to you, so.
I am so blessed you came into our lives.
Oh, hey. My wife is going to love this.
Blessed you came into our lives.
I know.
Okay, we'll bring back Hayman and Ryan, if you can come back in again. Okay, so your thoughts a little bit about autism. We've now had 8 kids that have come through with various amounts of autism, or somewhat on the spectrum, different areas of the spectrum. And Hayman, you've also had some experience too. So why don't you what do you think is going on here with the light and autism? What we're kind of seeing in the beginning stages here.
Well, why don't we have Hayman tell that story of the recent California experience with that one patient? That was pretty amazing. And then I'll kind of go into some of the mechanisms of what may be happening.
Yeah, no, so Ryan will be the expert on trying to explain the mechanisms here. And so what Tom knows is that I was trying to do some field tests, like usability trials, because I needed to believe, right? Because this is not my scope of care. This is not what my training was. But I deal with kids with autism. They're in every space, and oftentimes you have situations where you encounter quite a number of them. And so I was trying to get some feedback, and I had Tom's helmet, the transcranial photobiomodulation helmet. I had a Palm device, as well as a panel, and I was traveling in California and then now in Florida. And so basically, I just offered the option for these parents and their kids to come and try it out and give me some feedback. Because I know Tom was saying all this about autism patients. So before I got convinced, I actually asked Tom, can I call them up and find out from them? I got some prior details, set up a neutral sort of experience. So one of the families that tried it out was this mother and 2 sons. So the mother has autism. The sons, who are 6 and 4, both have autism, and they both have different grades. The 4-year-old actually has significant autism, where he's actually not communicative, does not verbalize anything. He's also he's restless. Always heard that he also sometimes bangs his head. And so what happened was they came over to the place where I was staying, and they were to do the helmet first. So the mom did the helmet. The 6-year-old did the helmet, no issues. The 4-year-old would not even go near the helmet. And so we said, okay. But they were discussing with the parent. They mentioned to me that he's someone who cannot sit properly. He's always like wandering around, jumping up around. He cannot stay still. And unfortunately for him, he has been kicked out of so many preschool programs because he wouldn't be able to play with the other kids. He was, getting into trouble. So these programs would not accept him. So the mom was desperate to try something. So when I'm speaking to them, they actually mentioned the only time he actually tolerates anything is when he's asleep. So they clip his nails at night. So because I had the Palm device with me, I said to the mom, why don't you take this device home and try the Palm on him while he's asleep, right? Because it's a smaller head, go ahead. And also, I remember Margaret Naser also telling me, Margaret Naser, the one at Boston University, she was telling me with stroke patients, what she has found is for speech difficulties, you always treat only the speech affected side, which is the left side of your brain, right? So what I told the mom was, please only put the light or irradiate. Don't get concerned about the radiation term. It's for light also, we use that term. So just cover just the left side. So that night, Friday, they came over, the mom and the older son did it. The younger son, they did it for him at night. So the protocol, Tom's protocol, which is 1 minute red, and then 3 to 4 minutes near infrared light. So they did that therapy, and what she reported to me the next day, she gave me a good history. She did it over the weekend and then returned the light back to me on Monday. And she said that night, all of them slept really well. That's the biggest point that we always hear back from all the users of the helmet. Sleep is improved. Secondly, the kid, 6-year-old kid, he actually was regulating himself better. He would escalate, like whenever he escalates in his behavior, he would de-escalate much faster. That's what she noticed after one treatment. Now, the biggest surprise was the younger kid, the 4-year-old. Much better. He was also starting to babble. So that was surprising. They've not seen that before.
So
And
he
that's-
didn't say he couldn't say anything or didn't say anything.
No.
And this is the first time, and
He was
I would
babbling.
think babbling, it means that, he's
trying.
and he's got to, now the brain has to start figuring out how to control that speech. So this is not, you can't just jump into speech. You'd have to go through this period, right? To try and.
So it's your brain is always like your centers are always working. And the thing is, we only radiated the side that actually has the speech centers, right? That's the left side of your brain. So again, it's unclear. It's the first thing we did, right? And also the behavior that continued. The sleep improved. They were still regular. And now there was only 3 days of treatment. And there's now a washout period where it basically means that they've not used the light for now a week and a half. So I'm waiting to hear back reports about what's happened since then. I'm still waiting to hear back. And the goal is to have long-term follow up with them and also provide them with the light as well so they could actually continue back on these treatments and see what progress we see. But that was a big surprise after just one treatment to see that small change. And also, I think, Tom, you had a patient who actually was banging their head, right? Against car windows coming up.
Yeah, and so he's banging his head against car windows. That's a normal activity whenever they drive somewhere, and the next day that didn't happen.
Yeah.
I know this is not autism. I'll just one other injection here is we had a woman that was 33 years old, and she had at 3 years old she was involved in a car accident with brain injury, and so she's partially paralyzed on one side, and saliva was just running down her cheek, and she could actually, if somebody put something in her hand, she could hold it, like her purse, but somebody'd have to bring it into her hand until she could finally clutch it, and then she could take it. The very first treatment, immediately following the treatment, she stopped drooling. and she was able to reach down and grab her purse handle and pick up her purse. After 30 years of not being, like, having this injury to the brain. So I have no idea if that rewires the brain or how, the neuroplasticity, what's going on, but
And I'm excited to hear what Ryan also has in terms of the mechanisms. But Ryan, one thing I found exciting about this 4-year-old kid is, if you think about it, the kid is sleeping. He doesn't even know the light is being applied to his head, right? So think about it from our scientific side, that's blinded trial. Like, no, they don't even know what they got. Right?
Yeah, they have no idea they're getting a treatment. So it's the actual treatment versus placebo, and he didn't know. So it's actually a physiologic effect that did take place. And the important thing, I mean, there's a lot of controversy as to what the cause of autism or neurodiversity spectrum disorders may be. But one of the key fundamental pathways is inflammation. So just like in Alzheimer's or Parkinson's or MS, there are common inflammatory pathways. And so what's interesting about photobiomodulation and using strong wavelengths of light is the ability to turn off certain inflammatory signals. So the last several years, we've all learned the word cytokine in the news, and cytokine storm and cytokine activity. Well, we have certain good cytokines, and it's basically a signal from a cell to a cell saying, hey, we recognize this pathogen or this danger. Why don't you upregulate? But then we can get into an excess inflammation pattern. And what near infrared light does is it will say to these cells that are sending out the signal, hey, downregulate that signal, quit sending that signal. We don't need this much inflammation. So there are things like the NLRP3 inflammasome. And you have that in the heart as well, like I was talking about earlier, but you also have that in neuroinflammation. And when that upregulates, then it says, okay, now we're going to make some worse cytokines. We're going to make some interleukin-1 beta and interleukin-18 and all these other things that are going to lead to cell death. So what the light does is it says, hey, cut that signal. We don't want these inflammatory cytokines. Then on top of that, there's a good one called interleukin-10, which also acts as an inhibitor of excess inflammation and shifts you from a state. We always need some inflammation in our body, just kind of a surveillance, but you have a calm pathway of inflammation and you have an agitated pathway. But what the light does is it shifts you into what we call this M1 pathway instead of an inflammatory M2 pathway. So it says to the cells, hey, let's surveil, but let's stay calm. And then the other thing in terms of like what you may have seen in this little 4-year-old, and again, I'm just hypothesizing, but as I was talking about in the heart cells, it increases the amount of energy production in the cell. And so the cell now has more energy to function, as well as it helps the cell get rid of what we call ROS, reactive oxygen species. So your cells are always, they're little factories, but you have to take out the garbage. And most of that happens in the brain at night when we're sleeping. We have a lymph system in the brain called the glymphatic system. But what it gives the cells an opportunity to do is to clean themselves out more quickly because each individual cell now has more energy to do that. Oh. And then it also shifts the metabolism of the cells. So from a glucose or a glycolysis pathway into what we call an oxidative phosphorylation pathway. So it shifts the metabolism of the cells, gives the cells more energy, gives the cells more opportunity to clean themselves out, promotes good cytokines, reduces bad cytokines. And so that shift in metabolism allows those cells to be not only one, more energetic, but two, you can actually literally, with that neuroplasticity that Tom mentioned earlier, you can literally grow new neurons. And there are studies that show that you can increase neuronal growth, but also the little wires that talk to each other and connect to each other called the synapses. All of a sudden, those synapses that may have not been connected or kind of pulled back or wrinkled up, stretch out and start talking cell to cell again. And so you're shifting into a calm, resting state with more energy and more ability to clean itself out. And then the supporting cells in the brain, they're called your microglia. Those are basically the inflammatory cells of the brain. It puts those into a lower inflammatory state. So there's all sorts of mechanisms whereby this could be happening. And you think of Winston's case, where after a stroke, you have excess blood in the tissues, you get a lot of inflammation. And in his case, it turned that inflammation down, obviously very quickly, because he saw a benefit after one treatment. And just like you mentioned, Hayman, this little one who was nonverbal and is now babbling, how long has this child had excess buildup of things that the cells couldn't clean out, and how those cells may have been energy starved, and that light triggered those wonderful pathways to wake up some of those cells that couldn't do what they were intended to do. So it's really cool to see this photobiomodulation start to affect so many different conditions. I mean, even in inflammatory bowel disease, a lot of those same inflammatory markers are present. There's one more called TNF alpha that it will downregulate as well. And so, in chronic bowel conditions, light will also shift some of your bad bacteria in the gut, your microbiome, downregulate those and upregulate some of your good ones. So there are so many areas. Some of these pathways are similar in different autoimmune diseases as well. So to be able to say to the cells, hey, calm pathway, not agitated pathway, more energy, take out the garbage. It just all adds up to it all adds up to better cellular functioning. And that's a really amazing thing. So I got a little nerdy there. I hope it was somewhat understandable, but these are some of the ways in which light is benefiting so many patients now.
Well, as a matter of fact, I'm probably here today because of the mini canopy. When I had, I ended up working far too many hours, and I was really worn out. I mean, I was trying to keep the business alive and and I just was dragging for weeks on end. So no energy reserves whatsoever. So when COVID hit me, I didn't know what was going on even. You can't comprehend how bad things are. And my son took me into the hospital, and they did the analysis, and they said I had really, really bad double lung pneumonia with COVID. And the best thing that happened for me actually is I left the hospital. They kicked me out because I didn't they wanted the protocol that you're supposed to have the shot, and I didn't take the shot. I just thought I wouldn't do that. I didn't think there was enough research behind it. So anyways, regardless, I had the double lung pneumonia, and they said, here's some antibiotics, go home. And my oxygen, when I put the oxygen meter on my finger before I went into the hospital, I thought, I wonder what it is. And I looked at it, it was 80. And I thought, I don't think that's very good. That's really bad, isn't it? I mean, so I went back home, and the next day I tried the meter again, and it was still 80. And so I ended even buying another blood ox meter to see what, if that one was bad or something, and it read 82. So there was a second confirmation. So what I did is I knew, because of a study that we were proposing to do at 3 hospitals, we were approved to do to save people's lives with COVID. This is my canopy light, which is basically like 15 of the palm lights. And I put that on my chest like this, and 10 minutes of the red, 10 minutes of the near infrared. And then my wife would hold it on my back, 10 minutes near red and 10 minutes near infrared. And, I don't understand the medical side of things very well, but I saw my blood oxygen level would come up about 1 to 2% after about 1 to 2 hours after it had increased to 1 to 2%, and then it would fall again. And then I do the next treatment and go up again a little bit and then come down. Well, after 2.5 weeks, all of a sudden, I was now into the low 90s. And all of a sudden I started coughing so much. I just couldn't stop coughing. It was just cough, 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 cough. So I thought, I must be getting worse. That's all that went through my mind. So I went back into the hospital, had another set of chest x-rays done. And they said your blood was good and no problem there. They said they monitored my heart. They said the heart was good, but they said your lungs are exceptional. So that was using the light on my lungs. So as I understand it, correct me if I'm wrong, but is that not part of that cytokine storm going on in my lungs? And I was able to tamper that down so that my lungs could start improving. And the coughing, if I understand it right, is just the way that you end up clearing your lungs out. And so it has to happen. Am I got it right or
Yeah, you do. And one thing I didn't mention is, because of that nitric oxide release that light stimulates, that will also dilate blood vessels. So you get about 30% more blood flow to whatever area where you're shining the light, which again helps that cleaning pathway. And you're absolutely right, it'll turn down those cytokines. And it also inhibits scarring or fibrosis. So a lot of COVID patients ended up with chronic scarring of the lung afterwards. There was a study done in, I think it was in Southern California, where they did a series of patients with COVID, and they did it on their back, and the patients that got the near-infrared light therapy all were released sooner and all did better than the patients that got the placebo light. And, it does depend, and I know these devices are, the highest power per square area on the market. And that's important because the duration, like Hayman was describing in this little one, where you get a longer effect, the better intensity lasts longer as well. So 1, you increased your blood flow. 2, you decreased those inflammatory cytokines. And 3, you inhibited the ability for the lungs to scar themselves. So all 3 very beneficial effects of photobiomodulation. And, it really, in retrospect, I wish it had been used a lot more in a lot more places, but the few studies that were done also did show benefit.
Mm-hmm. Well, now what I'd like to do is just play a short video on Parkinson's. This is one of the people that came to our husband and wife came, and they treated with, they used the helmet. And that was a 4-minute treatment as well. 1 minute of the red, 660 nanometer, and 3 minutes of the near infrared. So what we're going to do is we're going to play that second part.
Oh, you had Parkinson's probably 8 or 9 years. When his physiotherapist suggested we try your helmet, which is much more powerful, we said, of course we would. So we've had tremendous results from it.
One of the things that I noticed immediately was sense of taste. And for somebody who's had no taste for 4 or 5 years, I was eating second helpings at the table. I also ran into an increase in smell.
Okay. So is your wife a good cook? Maybe I shouldn't ask that. There could be trouble.
Yeah.
Well,
she's a good cook.
He's put on about 5 pounds since he started the helmet.
Right.
Because he's eating more now, which is good, because with Parkinson's, because you can lose your sense of taste. A lot of people lose weight.
Mm.
So that was a big improvement. And what was the other?
The increase in smell.
Yeah.
Again, I couldn't smell anything.
Yeah, that really surprised me when he could smell that. I think we found our best hope for keeping the Parkinson's at bay as long as we can through exercise and through the red light therapy. It's a great combination.
So she'd say, raise your right arm, and Terry would be able to respond better? Is that kind of the idea?
Yeah, yes.
And you've noticed a little difference too in expressions.
That was after the second session, that now he has a spontaneous smile, which he hasn't had in years. His face was always the Parkinson's mask, and now he has much more expression. And my family have noticed a huge difference in him with the expression and with engaging in conversation.
Right.
Because he was getting to the point where he would be sitting when we had company and very quiet and sometimes falling asleep and disengaged. We had about 30 people over Christmas Eve, and he was talking all night. And it was just great to see, and people were commenting on how much more engaged and how he was like he was, 3 or 4 years ago.
I used to get these aches and pains quite a bit from all my joints, but now virtually I go out with no pain whatsoever.
And when you would come in after a walk before the helmet, what would you do?
Yeah, before the helmet, I'd flop on the bed and be gone for an hour or so. But now I don't need to come in and lay down or anything. Basically, I just finish the walk and go on with what I'm doing.
Mm-hmm. So you've increased your energy through the use of the light helmet somehow.
Right. Yes.
Yeah. Oh, that's beautiful.
And one last thing that I didn't mention is that I find Terry walking a little more upright, because he does tend to stoop, and that was the major issue. But I've noticed since the helmet that he is walking a little straighter.
Okay, Ryan. Yeah, Hayman, come on. So what do you think of that one?
Well, again, it makes sense from a light mechanism point of view, and it's fantastic to see a patient improving like that. And again, there are reasons why it works. And, I had mentioned some of those earlier in what it's doing in the cells. So Parkinson's originates kind of at an area in the base of the brain called the basal ganglia. And in that area, you have production of dopamine, dopaminergic neurons, L-DOPA, and those in Parkinson's, the cells that make these essential molecules for motion and activity, those neurons are dying off. And when I talked about heart protection, that enzyme caspase 3, when it upregulates it, it says to the cell, okay, we're going into a self-implosion death pathway or apoptosis. So again, it downregulates some of those enzymes and says, no, we're going to stabilize this neuron and we're not going to allow this neuron to die off. There were some monkey studies where you can introduce a chemical, 1-methyl-4-phenyl-1,2,3,6-tetrahydropyridine, MPTP, and
No problem.
Yeah, but anyway, you can use that to induce a Parkinson's model in monkeys. And so what they did is they used that molecule to induce Parkinson's and then compared those to monkeys that got photobiomodulation. And comparatively, the monkeys that got the light had 70% more neurons. So their neurons were 70% more protected than the monkeys that had the Parkinson's chemical and didn't have protection. So a huge difference. And then in rat models, that walking, he walks straighter. They showed that in rat models as well, showing that the rats had better mobility after inducing that similar walking, the gait model, and irregular walking, irregular gait. And the thing that made me happiest about their story is when you get Parkinson's, because of the lack of communication, those synapses, those little wire connections, you end up having commonly Parkinson's depression and then the inability to express. And so to see him smiling is such a good sign that so much of what was happening in that neuroinflammatory pathway was kept in check and probably improved by the additional energy that those cells now have in that part of the brain that we're going to sleep. So it's fantastic.
I remember when he had come in through the second time treatment. She said, it's the first time he smiled at me in years.
Fantastic. Fantastic.
Yeah, the apathy is one of the things that's like people also treat it as if it's depression. Could be related to disease, but more so it's the disease itself that also leads to that apathy, especially the neuroinflammation in the substantia nigra region, as Ryan was saying, is key.
Wow. Well, this has been pretty neat. We're coming up to the end of the top of the hour here. What we'll do now is we'll answer a few more questions that we have. I don't think we can address all the questions. People have been sending us in quite a few questions. Can you scroll into the questions as well? Because then I don't have to read some of these fancy. Let's see. I'm just going to start rolling down them. Okay. Betty is asking, when you are able, can you tell me, do you have a chart that covers how long and how often to use the light for different parts of the body, please? That is something that we're working on to try and improve upon. But what we've seen is just thicker parts of the body, you need more time. When we're talking of the brain, we find the 1 minute, 3 minute protocol on a specific area seems to be enough to do it. Now, some people have had success with that length of treatment, but also some have treated longer. And we've really not had any issues with the longer treatments, but that's a good starting place with the 1 minute. So there's a question about go ahead.
real quick to that point, in those monkey and those rat models that I was talking about, there were no negative side effects from the light therapy. So in terms of, I too am working on helping with the applications for different body sites, and I think that's going to be a very important folio that we put out there. The the intensity of the light makes a difference. Obviously, this is a very good product in terms of the power of the light. There are some weaker products on the market that you would have to use them much longer to get a similar effect. And then some of those lasting effects, like Hayman saw in that little one, again, because of the intensity of the dose delivered, you can do those shorter protocols in terms of time of application.
Right, right. Yes, we've seen though. I do remember working. This was quite a while back, but with one of my other light devices, that it was like he had one of our. Well, he had about 25 of our devices. This is going way back to the Genesis technology that I developed. And he had like 25 of these units, and he was getting really good results in his pain clinic. And then when I developed the new one, for some, because of the bulb that we were using, it was actually half the power, didn't catch up on it. It still burned as much electricity, but half of it, more than half. There's at least a 50% reduction in light output. And he said he wanted to go back to the old ugly prototypes because they worked. And it wasn't until I realized that I needed to go to, in this case, this was the days of halogen bulbs. I had to go back to a Philips bulb. And when I did, I changed out the bulbs. And he said, dramatic difference. So we're talking half power was not giving him anywhere near the results that he was getting on all kinds of things until that power came back and was double or equivalent to what I first gave him. And so there is something to the fact that below a certain threshold, it may not be enough to accomplish the task, and you just won't get the effect that you're looking at unless you're going up over a certain amount. So that's something that I learned a long time ago with this other technology.
And also from the field test, Tom, I've realized that some of the people I've actually met, it's not formal, so I can't say the patients. So basically on the field test, they reported that they have other devices and they actually felt the effect more so with your device. So some person actually through the other clinician who I was interacting with, she said that she has this big setup that's like $40,000 or something, like massive panels. And she said she felt more with your simple lip small panel than she had ever felt before. So dosage, I think, is very important. And I think there's no standardization in the red light products right now. And we don't know, a lot of them don't describe like you do, the amount of power they have and the power per square centimeter.
And even if they do, most of them don't even have a proper measurement system to really do to really give good, accurate levels and measurements and calibrated. So it's a lot of the devices are just pulling numbers out of the random sky for what they are. So so there's a couple other questions here. It was mentioned about Bell's palsy. We've been able to see Bell's palsy being helped. One person knew about that and how it worked for that.
There's another one in there about cerebellar ataxia.
Okay, go for it.
That's a tough one because there's a mutant protein that accumulates called ataxin 3. So when that protein accumulates in the cell, it causes the cells to misfire, and then you have inability to control your motions. And again, because of the ability for the light to stimulate more power in the cell and increase the, like I mentioned, the garbage truck cleaning out the cells, that mutant protein buildup decreases. There's a handful of studies out there on cerebellar ataxia and photobiomodulation. And it's, again, similar inflammation pathways also get adjusted by the light, like I was mentioning earlier. But there are some studies that have shown some benefit with photobiomodulation and cerebellar ataxia. So again, a hopeful area that's present in the literature with more research yet to be done. But the studies that have been done so far have shown improvement in that condition.
And I know there's a lot of questions, and a lot of the things that actually work, I found, is exactly what Ryan Cole was saying also, is the inflammation. Like photobiomodulation works on inflammation. So if you think of all your conditions, and if there's an inflammatory component to it, it's going to help. And I didn't realize there's inflammation in autism, honestly, until just recently. So anytime, if you're thinking about it, if you're also, like, if we don't get to all the questions here, is that think of it as inflammation first. That's what the first target is, but it does more. It improves the energy of the mitochondria as well. But
we had one of the gentlemen who bought one of the palm lights off me for his wife. She had can you pronounce it for me? Lichen planus?
Lichen planus.
Okay. And she had gone for 3 years, every type of treatment under the sun and inside her mouth. I shouldn't say under the sun because she wasn't under any sunlight, just an expression. But she ended up getting the light and literally just opening her mouth. Now, I do have a oral probe that one can buy so that they can direct the light right inside the mouth at different places, but apparently it was her whole mouth was affected. And she did, after 3 years of going once a month to the clinic where they kept trying different things, in 1 week, it was totally like it would ebb and flow, but she'd never get rid of it. In 1 week, it totally cleaned it all up with just using the light, opening the mouth and shining the light in that way.
Yeah, again, inflammation. I mean, that's something I suffered 16 years ago, and I went through several years of, steroids to keep it in check and things that weren't working. I changed my lifestyle and my diet to a low inflammatory diet, and after years of unsuccessful treatments, the diet changed it for me. I wish I had the light knowledge back then. But again, it shows that if you can downregulate that inflammation, and that's what photobiomodulation can do, then obviously it can have a very beneficial effect. That's a fantastic case study in what it can do for skin and mouth conditions. That's fantastic.
Yeah. Well, we will have in about 6 months time another type of device for more oral use, making it easier, and it'll be being run some tests in a university. But we do know that there's for oral mucositis, that for cancer treatment, when people are going radiation and chemotherapy, their mouth basically breaks down. I don't know the proper term, but it's just a mess, and they have to stop chemotherapy. And it's now a standard of care, should be, but it was approved for that, for chemotherapy treatment with light.
That's called radiation necrosis. And what photobiomodulation does, again, it stabilizes those cell membranes so the cells don't go into that self-destruction pathway. So instead of ending up with, necrotic or broken down tissue, it's allowing those cells to still produce enough energy that they don't break down.
Mm-hmm. So John is asking, what about sciatica? Yes, I've seen really beautiful results with sciatic hip pain using the palm light, on the area. And it's going to take some time, and treatment time too, because now you've got a lot more skin to penetrate, a lot more flesh to penetrate before you can reach the center core area. So you're looking at like 10 minutes of the red and like 20 minutes of the near infrared on an area. And you can always treat longer if you like, but basically that needs to be done, and I would even suggest 2 or 3 times a day if you have the possibility. Some would ask, well, maybe I should just do it once a day. Well, unless there's a strong reason why you have to, we've had some people really respond very well with doing multiple treatments per day. Your thoughts on that? Is that something?
Yeah, I agree with your assessment there. And as Hayman will tell you, as he, treats patients with, different injuries and whatnot as well, that sciatica can sometimes be an anatomical pinching, but whenever you get that, you're still going to get inflammation at the site where the nerves are impinged. And I agree with what you said, Tom, in terms of the depth of penetration. You're going to need more time to stimulate those deeper tissues.
And also, one
ahead.
thing, Tom, that say photobiomodulation, what we know also it does is reduces pain, right? So in sciatica, you not only have the inflammation, but you have the nerve irritation that's causing the pain, nerve compression or irritation that's causing pain. So the benefit I would always recommend is it's part of your recovery, right? The photobiomodulation should be part of your recovery journey
Yes.
here. So it'll reduce the pain, it'll reduce inflammation. And then the key thing is, then you get moving, do the exercises, continue to upgrade, and eventually that nerve will give it time and the nerve will heal. And that's the idea behind like any treatment that you do, is that you're reducing the pain, reducing inflammation, and moving and building up those muscles in that area so you support and protect that nerve and allow it to heal. And that's true for not only your shoulders, your neck. A lot of people we've tried the field test on have neck pain, significant neck pain, cervical pain that radiates down to the shoulder or down to mid upper arm. Same thing as sciatica. It's basically, think of it's like sciatica then up the upper body. That's what it is.
So Carla mentions here, thank you everyone for all your questions and your kind responses to having this interaction and this webinar. But Carla's saying, I have a meniscus tear. I was treating it for less than 5 minutes each light setting. I have 660 and 1150 and 1050. There was very little change in pain and range of motion. I began treating every night for 30 minutes on each setting. Game changer. I now treat maybe once per week, but I'm pretty much pain free. And that was a tear as well for yourself, Ron, in your shoulder?
Yes.
So this is and for knees, again, it reduces the pain, reduces inflammation. The only thing is, I would recommend that you do the rehab as well on top. Do those exercises to strengthen the muscles, because the gains that you make just compounds. It'll just get better and better when you do those exercises as well.
I think we're going to wrap up with questions here in a minute. But are you okay for 2 more minutes, guys?
Sure.
Okay. Hayman? Oh.
Yeah, sorry. What was the other?
Are you good for another 2-3 minutes?
Yeah.
Okay.
Yeah.
He's breaking up a little bit. Okay. Richard is asking, anybody have experience with fetal alcohol syndrome? I have no idea, what that might mean, or can it be helped? I don't know. Any thoughts? That's a tough one.
Well, that's a tough one. I can only conjecture that, with some of the neuroinhibition or the neural challenges that are faced by some of those children that are born with fetal alcohol syndrome, that maybe it could help in terms of awakening some of the brain cells, giving them more connection and activity. But I'm only conjecturing. I don't know.
There's a question there about CAA, cerebral amyloid antipathy.
Angiopathy.
Hey, there we go. Thank you.
That's a good question. The amyloid actually builds up in the middle wall of the vessel. So you're not technically, I don't know, and I'll have to research more how light affects amyloid. So amyloid is basically a misfolded protein that is strongly bonded and difficult to break down. Now, we do know that light can decrease scarring. It can induce remodeling in certain tissues back to normal form in mouse models. But in terms of amyloid, an atypical protein collecting in an atypical location, It will certainly improve blood flow to the area through nitric oxide release, but I'll have to do some more research on what it can or can't do
Yeah.
to amyloid
Okay.
protein.
I see another friend online here. Jennifer Hibberd is on.
Oh, wonderful.
Hey, Jennifer, do you want to turn on your video or bad hair day?
She probably just got home from clinic.
Jennifer, why don't you join us if you can? Okay, yeah, if you can, that'd be wonderful. Oh, there we go. She's up. Hey!
Good to see you, Jennifer.
You're still muted there.
Oh, there we go. I'm unmuted now.
So,
Is that
Jennifer,
better? Yeah.
I got a chance to connect with Jennifer a number of years ago, and it's been a great chance to meet each other. And not only that, she's a super supporter and has seen her own a journey with light. And Jennifer, how about you? You know, our other candidates here online, our other panelists.
Yeah, no, I've got all the various forms of lights that Tom has been making, because I was so impressed with the power and just his background. And, you know, you developed the first dental lights for curing residents. You know, that's in my field too. Yeah. So
nobody knew what to do with this because it didn't have a curve on it. I have the little light on the end, so they would always look at this and until they got used to it, because you don't have to open your jaw very wide to get the light right back at the back molars instead of the normal technology. So there it was, and you just set the settings and dropped it in the charger. But that was the prerequisite for me to get into red light therapy. This doing the high power blue light.
And I got news for you. That was just change of technology and amazing forward move in the dental field. I mean, really phenomenal. So, and then of course, your history, which I don't know if people know about it, but just how you got into the red light therapy. And it's been life-changing. And I have it in my clinic. I've got one of the helmets in my clinic. I specialize in pediatrics, so I have a lot of kids. I have to say, like everybody's talking about, and I've been seeing in my clinic the last few years, huge uptick in children on the spectrum. And I mean on the extreme spectrum, not calling everything on the spectrum. But I've got a lot of autistic kids in the practice. So I'm introducing them to the light. I've got the palm light in there too. I've got it home. I let people use it here too and share it, so that, and various injuries that people have had, it's made such a big difference. Knee injuries, use it to, shine on your thyroid, on your hormone organs and just hormone regulators, and the back of the neck, like you were talking about with head sprains. We're talking about effect on the eyes. I know I'm jumping all over the place, but it's just, it's exploding, right? And Ryan, it's so good to have you here, because with your expertise and background, just helping with the research and looking into this, and it's fascinating because we're all benefiting from it.
Well, and if it hadn't been for that dinner at Dr. Hibberd's house, I never would have learned about it 2 years ago, and I may still have a torn tendon. So it's come full circle to have to be on the podcast here with Tom and Hayman and have you join in. This is great.
Well, it's my pleasure, and I can't connect enough people with this like we all feel now, because our mission now is to find all these wonderful technologies, develop them more, and share them with everybody we can in the best way we can. So thank you to all of you too.
Oh, that's fantastic. So I thank everyone for coming on, and I know that we'll just keep going with questions, but I want to mention to everybody out there that on Thursday night, with Steve Kirsch's program, he's going to be talking about PBM, and he's invited me, and so Thursday night of this week. So we will be talking about many of the same things. So we'll be putting it out there, the link to get onto Steve's webinar. And
So that's VSRF, Vaccine Safety Research Foundation.org, VSRF.org. That's on Thursday night. And then on May 14th, the Independent Medical Alliance, IMAHealth.org. We'll talk about your devices as well, Tom, on that one. But we're also having a seminar on May 14th about light. So we've got some good ones coming up to continue to answer. I know there are more questions than we could answer tonight. We'll try to continue to address those questions in the upcoming webinars and continue to get the word out about the great benefits of photobiomodulation.
yeah, and it's pretty neat to see now with the Maha movement and where that will go in the States. So anyways, I want to thank you, Jennifer, for joining us on short notice like this. Short notice, you had no notice.
That's good. Hey, the best way to be, right? Spontaneous.
Yeah. So I want to thank everybody for joining us tonight. And listen, I wish all of you.
And Tom, just one thing, just so that we don't leave anyone hanging, because I know there's a lot of questions. The tip I'll give every one of you, I looked at all those questions you asked, and I think the tip I would say is when you're Googling or asking, searching all these conditions, check if there's any inflammatory component to them. Right? If you do find an inflammatory component, PBM will help. All right. So that's the easiest thing. And for the deep brain structure, the question about locus coeruleus, there is evidence that there's veins. Look up Dr. Margaret Naser's research, epiphyseal veins. There's actually research that when you treat the head, because of these veins, you actually get deep penetration of the photon, and the energy that treats the veins actually going down. It gets transmitted by the cells, the mitochondria that actually get transported in there. So yeah, there are different ways that we can get light deeper into the brain.
Yeah, and even one more thing is that in discussing with also not only Ryan but Mark Cronshaw from Europe, from England, is that there's more coming out that the cells do talk to each other with light, and there's light transmission like fiber optics going throughout the whole body. So everybody thought the electrical system was what was going on between all parts of the body, and now we're learning that on top of the electrical system there's a whole fiber optic network that's in your body that's communicating light. So fantastic things, which I say how God designed the body. It's pretty neat. So anyways, listen, all the best, and thank you, Hayman, for coming on tonight. Thank you, Jennifer. Thank you, Ryan, for doing this. So many people will be helped because of what you've taken this time out to spend with us. Thank you.
Thank you.
Our pleasure. It's
you,
all about frequency, you guys.
And may you all be richly blessed this week. All the best. Bye for now.
Bye.
Bye.